are working within a range of different contexts, from global health and humanitarian settings to our very own HSE, to mitigate and adapt to this threat and instill hope and action in our health systems. We'll move through the individual presentations in relatively quick succession today and provide time for questions and answers during the joint panel discussions to close the webinar. I'd now like to hand over to Dr. Tim Collins, CEO of the Irish Heart Foundation and former advisor to the Department of Environment, to present some opening remarks. Tim, over to you.
Thanks, Hannah. Well, first of all, I'd like to thank the Irish Global Health Network, Irish Doctors for the Environment and MSF Ireland for organising this launch event and for asking me to deliver some short opening comments, and they will be short. Since 2015, the Lancet has shown remarkable leadership in highlighting health issues relating to the climate crisis and holding governments around the world to account for their commitments under the Paris Agreement. They've also highlighted an important reality, that the climate crisis is the single greatest health threat facing the world, and at the same time, the greatest health opportunity, in that most of the actions required to tackle the crisis will have huge health benefits, particularly in tackling the root causes of many non-communicable diseases. Just this week, the WHO said that NCDs made up 7 of the top 10 causes of death globally. Heart disease, then stroke and COPD leading the pack, with lack of physical activity, unhealthy diets and air pollution among the main causes. As everybody knows, we have engineered daily physical activity out of our lives. Our diets are heavily influenced by large-scale marketing from the manufacturers of processed foods, and poor air quality from transport and solid fuel burning is killing 1,300 people every year in Ireland alone. As health professionals or people with an interest in health issues, you will all be aware of the contrast between the importance and cost effectiveness of disease prevention and the actual resources committed to it by the state. Healthy Ireland, which you'll all be aware of, has a budget of 20 million, up from 5 million last year, in a sector where the state will spend 20 billion this year on health services. And the reasons for this gap are obvious. The urgent, such as reducing waiting lists, always takes priority over investing in prevention activity that may take decades to impact. Mark Carney, the former governor of the Bank of England, called it the tragedy of the horizon. That is, the chronic inability of our leaders to tackle challenges that extend more than a few years or one election cycle ahead. And we are surrounded by real life examples of this every day: our chronic housing shortage, our creaking wastewater infrastructure, and the list goes on. But probably the best example of the tragedy of the horizon is the climate crisis, an existential threat that until very recently has barely registered among the day-to-day concerns of many people, including our politicians. The past 4 years of Trump, Bolsonaro, and Brexit has undermined our confidence that the global order was even capable of acknowledging, let alone tackling, this common threat. Record temperatures, wildfires, and shrinking glaciers have also fed a narrative that individual action is futile, Ireland is too small to make a difference, and the best we can hope for is adaptation, as it's too late to mitigate. However, as 2020 draws to a close and we move into a new year, there is, I believe, cause for hope. Joe Biden will be the next US president. He has appointed John Kerry as his climate envoy and has pledged to rejoin the Paris Agreement. And he has adopted much of the Green New Deal agenda from the left of his party. Closer to home, Ursula von der Leyen has pushed through a European version of the Green New Deal. And with the recent electoral success of the Green Party, we now have government in Ireland that is committed to climate action. But perhaps the one thing that has given many people reason to hope, however, is the way that the world has responded to COVID-19. By and large, countries have worked together, the role of science has come to the fore, and knowledge and information have been shared towards a common cause. The world has seen how, when we come together and marshal our efforts, we are capable of taking on and overcoming even the toughest challenges. And perhaps the biggest lesson we've learned from the COVID-19 crisis is that the cost of responding in terms of massive increases in public expenditure is not an obstacle. Governments around the world have mobilized billions on an unprecedented scale and been happy to set aside the usual fiscal rules for the greater good. If we can take this model and these attitudes and apply them to tackling the climate crisis, there is truly reason to hope. So what's stopping us? What's in the way of the type of urgent and immediate action that's clearly needed? We know that the current climate commitments by national governments are not enough. If we are to achieve a 7.6% annual reduction in emissions over the next 10 years, much more radical action is required, and we know we are rapidly running out of time. The biggest barrier remains the perception that while COVID is today's problem, the climate crisis is still for many an abstract and distant problem for another day. And that brings us back to the power of linking the immediate health impacts with climate action. By highlighting the immediate threats to health, such as the huge increase in heat-related mortality described in this Lancet Countdown Report, and the massive health benefits of improved public transport, more cycle lanes, less intensive agriculture, healthier diets with less meat and less processed and junk food, cleaner air and more livable cities, we can use our voice to make the case for urgent action. Almost a year ago, a number of health organisations came together to form the Climate and Health Alliance, and they include the Irish Heart Foundation, where I work, the Cancer Society, the College of General Practitioners, the Royal College of Surgeons, College of Physicians, the IMO, and a number of others. And we identified 3 areas for action, 3 best buys, if you like. That's improving air quality, increasing active transport, and moving to more sustainable diets. And just to take poor air quality as one example, as I said, it's responsible for 1,300 deaths every year in Ireland. That's more than 10 times the number killed on our roads last year. A ban on smoky solid fuel extended nationwide would have a significant impact on this figure and reduce carbon emissions. And pressure from health professionals might just make the difference in persuading the government to stop dragging its heels on this issue. And I could go on, but the message is clear. The health sector can make a huge difference. And the Lancet Countdown on Health and Climate Change, I think, is the evidence base we need to make our case across all of these issues. Thank you very much, and enjoy the rest of this really interesting seminar.
Thank you, Tim. So next up is Professor Karyn Morrissey. Karyn is going to walk us through some of the key findings from this year's Lancet Countdown Report. And Karyn is a professor at the University of Exeter with a research focus on understanding the impact of socioeconomic and environmental inequalities. So Karyn, over to you, and looking forward to hearing from your experience co-authoring the Lancet over the past couple of years.
Thank you. Thank you, Tim. That was a really, pitch perfect introduction to today's meeting, I believe. So I'd like to start by saying good afternoon, everybody. And on the eve of the 5th anniversary of the 2015 Paris Agreement, where countries committed to limit global warming to well below 2 degrees on pre-industrial temperatures, I'd like to start by thanking the MSF, Irish Doctors for the Environment, and the Irish Global Health Network for asking me to present some of the key findings of the 2020 Lancet Countdown on Health and Climate Change at this Irish launch. So, as my fellow panelists today, Dr. Maria Guevara writes in the Lancet Countdown's policy brief on the humanitarian impacts of climate change. In a matter of months, the COVID pandemic has stopped the world in its tracks, infecting, killing, and posing serious challenges for the world's population, especially the vulnerable, and driving economic and social systems to their knees, whilst outstripping the healthcare system's capacity in most parts of the world. What Dr. Guevara and us at the Lancet Countdown conclude is that what is also blatantly obvious is that the COVID crisis is not one that we have the luxury of tackling alone. As the Australian wildfire season starts again, we clearly see that the COVID pandemic and climate change represent converging crises within the same family of challenges. An expanding human population, continued exploitation and encroachment on nature and remaining wildlife habitat. The health effects of climate change are being compounded by the impacts of the pandemic. And unfortunately, this isn't unique to 2020. And I kind of put my head down when people say, oh, I'm glad when this is all over, because I firmly believe that this is actually a glimpse of our future. And I also firmly believe it is our job as health professionals, be it clinicians, researchers, or academics, that is our job to meet the threat of climate change with the same passion as we have met that of COVID-19. So just let me switch. So 2015 saw the publication of the first Lancet Commission on Climate Change and Human Health. And as Tim alluded to, it concluded that anthropogenic climate change threatens to undermine the past 50 years of gains in public health, and in itself presents the greatest global health opportunity of the 21st century. Recognizing the threat climate change poses for global health and for health professionals to be active in the fight to tackle climate change. Each year since 2015, the Lancet Commission has brought together over 120 climate scientists and geographers, mathematicians, physicists, transport and energy experts, development experts, engineers, economists like myself, social and political scientists, health professionals from over 38 leading academic and UN institutions globally, to publish the Lancet Countdown Annual Report, which aims to track the impact and highlight the impact of climate change on human health. Reporting on 43 indicators across 5 sections, or for those of us that work on the actual publication, as we call working groups. The 5 working groups look at climate change impacts, exposures and vulnerabilities, adaptation, planning and resilience for health, mitigation actions and health co-benefits, economics and finance, and public and political engagement in climate change. The fifth Lancet Countdown reports across each of these 5 sets of indicators reveals its worst outlook for public health since its inception, along with a number of key messages, which include that as global carbon dioxide emissions continue to rise steadily with no convincing or sustained abatement, no country, whether rich or poor, small or big, island or not, is immune from the health impacts of climate change. Indicators in section 1, as I said, collectively refer to climate change impacts, exposures and vulnerabilities, are highlighting the very real impact of climate change on health across every continent. Studies from 2015 to 2020 have shown the fingerprints of climate change in 76 flood, drought, storm and temperature anomalies, from wildfires in Australia to drought in China and Bangladesh. People around the world are facing increasing extremes of heat, food and water insecurity, and changing patterns of infectious disease. And this is happening right now. It's not in the future. Furthermore, while no country, again, whether rich or poor, is immune, our data clearly shows that climate change places undue burden on the countries least responsible and least able to respond, with low-income and middle-income countries experiencing multiple impacts simultaneously. This is further highlighted by the indicators presented in section 4, which present the economic and financial dimensions of the impacts of climate change. Here we found that in 2019, economic losses from climate-related extreme events were nearly 5 times greater in low-income countries than that in high-income countries. However, whilst the report has indicated a strong need for urgent action globally, climate change mitigation efforts are failing, as Tim alluded to. The indicators that comprise section 3, that which we refer to as mitigation actions and health co-benefits, showed that in 2018, there is a concerning paucity of mitigation progress in numerous sections, including a continued failure to reduce carbon intensity within our global energy sector, an increase in the use of coal-fired power, stations, and a rise in agricultural emissions and premature deaths from excess red meat consumption. Although, of course, there is positives in terms of the continuing growth in renewable energy and improvements in low carbon transport, we really must consider that these large gains that we may see are from incredibly small starting baselines. So the second key message that the Lancet Countdown wants to deliver is that the COVID-19 pandemic and climate change represent converging crises, and as I said, within the same family of global challenges. Responding to climate change today will bring about cleaner skies, healthier diets, and safer places to live, as well as reducing the risk factors of future infectious diseases that we are currently battling with. However, it's not all bad news in terms of our indicators. So, for example, our indicators do suggest that amidst a year in which we have placed more trust in the health sector than ever before, we have seen signs of growing momentum within the healthcare profession with climate change. Impressively, health services in 86 countries are now connected with their equivalent Met Office services so that we can assist in health adaptation planning. Responsible of between 4 to 6 of UK emissions and an area that I'm working in at the moment, the NHS is actually taking numerous steps to try and decarbonize, with the NHS committing, for example, to going to net zero by 2040 or earlier, making it the world's first healthcare system to make such a bold commitment. While the indicators presented in Section 5, public and political engagement in climate change and human health, indicate that we're seeing more people than ever make the links between health and climate change. For example, from 2018 to 2019, the coverage of health and climate change in the media increased by 96% worldwide, outpacing the increased coverage of climate change overall and reaching the highest observed point to date. People are now seeing climate change and human health as synonymous. However, good or bad news stories aside, what the 2020 Lancet report indicates is that along with a growing understanding of the human costs of a warming climate from a science and clinician professional perspective, it is now more than ever important for adaptation measures to protect public health and human health more generally. So when asked to speak today, Hannah and her colleagues asked me to focus on the adaptation part of the Lancet Commission, which was quite fortunate because this is the part that I'm most involved with. And I'm going to take the next few slides to take some time to run through some of our findings, because as Tim indicated, it seems now as if the world is moving towards the idea that adaptation rather than mitigation seems to be our only hope. Whether or not this is true, there's going to be a discussion towards the end. As such, tracking adaptation measures is a key priority for the Lancet Commission. And the indicators provided in Section 2, collectively referred to as adaptation, planning and resilience for health, document current and future adaptation measures across the globe, across the following domains: adaptation planning, climate information systems, adaptation delivery, and adaptation spending. Adaptation planning and risk management is essential across all levels of government, with national strategy and coordination linked to subnational and local implementation and delivery. The set of indicators comprising 2.1 highlight the number of countries and cities with health and climate change plans or strategy. Here I focus on indicator 2.2, which represents the number of countries which have undertaken a climate change and health vulnerability assessment at the national level. Here we see that less than half of responding countries indicated that a national assessment of health vulnerability to climate change has been conducted. This is worrying in itself, because if we don't understand where the vulnerabilities of our healthcare profession, where our health services are, we are going to be in the same situation as that of in March 2020 at the onset of the COVID pandemic. In terms of subnational, focusing on the subnational level, globally cities are home to 55% of the global population. This rises to 75% in Europe, and currently approximately 68% of the Irish population reside in urban areas. Furthermore, cities produce 80% of our global GDP, consume 2/3 of the world's energy, and thus represent a crucial component of local adaptation response to climate change. My work on the Lancet Commission is represented in indicators 2.13 and 2.13, which captures data on cities that have undertaken a climate change risk or vulnerability assessment and the perceived vulnerability of city leaders of their public health assets to climate change. Here we see that in 2019, unlike at the global level, cities are responding in a much faster way to understanding the possible effects, or wanting to understand the possible effects of climate change on their cities. And importantly, 67% of global cities surveyed expected climate change to seriously compromise their public health assets and infrastructure.
All right, Karyn, we just have 2 more minutes left on this.
Perfect. So the number of moving parts that are required to inform and prepare adaptation plans require broad partnerships. And as I said, it's really exciting to see that so many health services have joined up with their Met offices to further inform adaptation planning. Here we see that the number of countries reporting that they are working with their Met office is continuing to grow. So the final indicator here that I'm going to speak to is one that I'm sure all of you will be interested in, and it's around global green space. Nature itself provides a natural adaptation to the hazards associated with climate change. Urban green space is an important measure to help reduce population exposure to heat and air pollution. Our newest indicator in 2.3.1 finds that 9% of the global urban centres had a very high or exceptionally high degree of greenness in 2019, and more than 156 million people were living in urban centres with concerning low levels of urban green space. So, in conclusion, with global average temperatures having risen to 1.2 degrees more than that in pre-industrial times, the indicators contained in the 2020 report provide insights into the health impacts of climate change today and in the future. At the same time, the public health and financial efforts of COVID-19 will be felt for years to come, and efforts to protect and rebuild local communities and national economies will need to be robust and sustained. However, while the window of opportunity is narrow, we still have time to change our course. A joined-up response to converging crises can deliver triple win: better public health, a sustained economy, and environmental protection. So on the eve of the 5th anniversary of the adoption of the Paris Agreement, and as countries set their nationally determined contributions to this agreement, I really want to press that time to act is now. Thank you.
Thank you, Karyn. So I'm just seeing a couple of comments coming into the chat box. We'll definitely address those in the panel discussion upcoming. Up next is Dr. Ina Kelly, member of the Climate Change Advisory Council Adaptation Committee, work in the Department of Communications, Climate Action and Environment. Aina was also on the recent sectoral adaptation team of the Department of Health, which produced the statutory health sector climate change adaptation plan in 2019. I'm looking forward to getting a better understanding of the public health perspective in Ireland and the national adaptation framework. Over to you.
Okay, thank you very much. That's very good. Let's get my screen here, right? Can you see me? Can you see this coming up okay?
Perfect, thank you.
Okay, grand. Okay, well, look, thank you very much for inviting me along to this. I feel a bit of a fraud because I spent very little of 2020 involved in climate action, unfortunately. And one of the reasons is, as you know, COVID-19. I will talk about health impacts of climate change and prevention and sustainability, climate change adaptation and the National Adaptation Framework, Health Sector Plan 2020 and how it's impacted and what happens next. I suppose this is a very busy slide that I developed some years ago, just looking at the literature on the impacts of climate change and the effects of climate change on the environment. And then that's how it generally impacts upon health. And it's a busy, busy slide, but actually all of those arrows have documented links, and we have found a certain number of these have actually, we've seen them visibly in public health in Ireland. We've obviously known we've had disrupted essential healthcare and disrupted emergency systems from flooding. We've had them also during heat waves as well. We've had drowning during flooding. We've had infectious diseases, outbreaks of gastrointestinal illness during drought and during flooding as well. And I'm sure there's an awful lot more we would know about if we were able to have time to do the environmental epidemiology that we need to do. Unfortunately, like a lot of places, the sorts of resources that are required to do that are not in place at this moment in time. But it's something we know we need to be doing, and we expect to, obviously what doesn't get measured gets ignored a bit as well. So it's an important area for the future. We talk about prevention and sustainability. I mean, prevention, we still have to do climate change mitigation because of the fact that the carbon emissions that we are producing at the moment are going to create such a challenge to the health of the global health that we would not be able to adapt properly to that. And therefore we have to focus on mitigation all of the time, as well as adaptation. And most of the work I do is in adaptation, but I just mentioned this here. I do very little on sustainability per se, but there are very few people in public health involved in this. In the HSE where I work, the National Health Sustainability Office is the arbiter of this. They have a strategy for health, but I would feel just working in the HSE that I don't feel it's reaching into the organisation very much. It's a huge organisation, huge challenge, of course, to get it across the system, needs a lot of resources to get there. But I don't feel it from a day-to-day working. I don't see that an awful lot of the things that I would do at home are actually being carried out in the workplace. I think the breadth of ambition, I think, might be a little narrow. I think we need to have massive ambition for mitigation. It's really important that we are working all of the time to reduce our emissions and to reduce waste and so on. I think the follow through that I found isn't really good enough when I've tried to fix things that just don't happen. So I'm a little concerned about that too. I think it's obviously out of date at the moment, and I hope that will be dealt with, that they'll update it and maybe address some of these things in it. And I think it needs to be integrated with others and working and planning with others who are involved in climate change. So I think, so there is something there, but I think it's not sufficient at this moment in time. And as some of my colleagues in the Irish Doctors for the Environment keep saying, if the health system was a country, the World Health System was a country to be the 5th biggest emitter of greenhouse gases. So it's very important our health sector comes on board with this. Now, the National Adaptation Framework is Ireland's response to adaptation. It's been in the legislation, 2015 legislation was the basis for the framework. The Department of Communications, Climate Action and the Environment is the leader on this, and they have been having steering and leading on this for I don't know if it's 5 years or something like that. And since the framework and since it has been created, now they're in the monitoring and phase of this. Their framework explores the the potential implications of climate change in Ireland and looked at it in a fair amount of detail, depending, of course, on the sectoral input into this. They have laid out the strategy for the development of adaptation measures across many sectors, key sectors and local authorities. There are a few things that I feel, I just mentioned myself, it definitely recognised the interdependencies, which is terribly important because all the sectors are integrated in some way, or no, they're interdependent in each other in some ways, but actually we're not integrated and we're still in silos. So that's something that we're going to have to address, I think, an awful lot in the future if we want to adapt appropriately and not be spending money on avoidable maladaptation. Sectoral gaps, I think, were identified as well. I think the coastal system, I think the coastal protection and so on is across too many sectors, and there wasn't really a focus on that, and I think that was well understood. Also, I think housing wasn't included, and of course housing is the environment in which we all live, really. It's terribly important, but actually wasn't included in the first round. And of course adaptation is going to be about rounds of this. We're going to have to keep learning from it and keep adapting even our plans as we go along. The health sector plan was developed in a very, very short period of time. I think myself and another colleague in the Department of Health were very involved in this in some since about 2013. But however, there was no engagement with the Department of Health on this, or I can't say engagement, there was very little, it was not a priority. And I think that it really only became a priority in the last 6 months or so. So it was quite a rushed task, and I'd say that the people in the Department of Health who produced this did a fantastic job because they had to put a huge amount of effort into a very short period of time. You know, you can't work without a mandate, and I think it's just not a priority in the health sector at the moment. And that's something that we're going to have to try and push towards. The key areas of action identified were UV radiation and sun exposure. Now, and I suppose insofar as the improving weather, or improving climate from an Irish point of view, it sometimes means that we go outside more and more and but unfortunately we get sun exposure. So that's, I suppose, working with the National Cancer Control Programme towards prevention of sun exposure is very important. And the worsening of air pollution due to climate change was actually considered another area because of the large numbers involved in these particular two areas, the UV radiation and the air pollution issues. The severe weather, of course, is one of the ones that's a big, it's big, where a lot of the issues are likely to occur because of storms, heat waves, flooding, and so on. And they affect people, maybe small numbers at a period of time, but they are very important because they're the areas where you have to be, if you're putting your adaptation in there, you can protect for normal times as well. Now, one of the things about the plan is that the oversight group that is supposed to be helping with getting this adaptation plan done, it hasn't been set up to the best of my knowledge. I'll talk about that in a few minutes. The health sector in 2020 has been completely and utterly overwhelmed by COVID-19, or at least its actions have been overwhelmed. It's been from a public health perspective, we have been getting involved in it since actually the 31st of December 2019. And it's just been from the public health doctors have been working just on all of these things like risk assessments, outbreak managements everywhere. We had learning lessons from wave 1, going on to wave 2. It's taking off again at the moment. So it's a struggle for me to even be able to attend here today because we're so busy with outbreaks at the moment. Just talking about the progress in the health sector, we have the oversight group, as I mentioned. I don't think there have been any developments in that area. The National Adaptation Steering Committee is monitoring progress, but I'm not aware of any progress in the health side at the moment. I do think, though, from working in COVID-19, I think that we do need to develop synergisms, but I'm not aware of any actions in relation to that. And I think the adverse aspects of COVID-19, I hear nothing about waste management in relation to PPE and so on as well. So I'm not aware of any actions in that regard either. So what happens next? I think we need to identify all the synergies and try and use them wherever we can. I think the remote working and reduced commuting, I'm sure, is reducing emissions from traffic, and that will also have a benefit for public health through better air quality, cardiovascular and respiratory health. I think the COVID-19 change of avoiding congested transport. I mean, obviously we like public transport from an efficiency point of view, from a climate change point of view, but obviously that really pushes the active transport agenda now. So you get the reduced emissions from traffic and better air quality and physical activity benefits. So maybe COVID-19 has really made a big difference in that regard. At least in Ireland, it's working in certain parts of the country, like Dublin, I think. International travel reduction, of course, will help to reduce carbon emissions, and we'll have less noise and air pollution from that. Greater interest in the local economy. I suppose it's something we all perceive as the focus on our shopping locally, which might reduce our carbon footprint if we're buying local goods and so on, and economic resilience can be built. Greater interest in ventilation. I found that's something we were struggling with because the housing wasn't involved in adaptation, but I think it's brought to light that ventilation matters, air quality, indoor air quality matters. And I think that climate change has pushed towards air tightness, but hasn't really thought about the air quality indoors. So I think the COVID-19 interest in ventilation might help to bring that to light a bit. Greater interest in societal inequality and low pay issues. In COVID-19, we obviously found an awful lot of low pay workers were going to work with symptoms of COVID-19. So I think this helped to raise the greater understanding of the global inequalities and determinants, of climate change and global health, really. And I think that from a public health perspective, we would see that there's a greater focus on the societal benefit of addressing health inequalities. Addressing health inequalities helps everybody. It's not just, it's not just for people who are directly impacted. It's good for society. And I think the challenge to the status quo in COVID-19 has been a great. It's a great, shaker-upper in some ways. We have an opportunity now, I think, for climate change to lead for a better future. And I think the public's willingness to prioritise health is fairly obvious, that so many people really were taking on horrendous restrictions, and still because of their willingness to put health first. The adverse effects from COVID-19, I think, in relation to climate change, there's a lot of pressure on many aspects of sustainability and adaptation, like waste, for instance, and the personal protective equipment, or because they are also population protective equipment with single-use plastics, single-use masks, and so on. Home heating, if we don't have sustainable heating systems, that may have pushed more towards home heating, which may or may not be working. We may be using a lot more, especially down the country where I live, we could be using a lot more briquettes and peat briquettes and so on, and non-sustainable health systems or heating systems. Mental health, it's mainly unmeasurable. At the moment, I've heard of a few surveys and so on, but very little where there's been any measure put on it. But there's a great concern, and I think none of us would have any doubts. It's just that measuring things can take a significant amount of time to do that, and resources. Social solidarity, I think, has been a marvelous benefit. However, people have sacrificed a lot, and will they be willing to do more? I think we can't take social solidarity for granted. We've got to keep building it. And I think with public health, again, just my own perspective, I know that, or your public health perspective, we've under-resourced prevention services. I mean, public health is mainly about different types of prevention, and we are a very under-resourced service, as are many other countries, as we can see. The COVID response indicated how public health resources have been diminished in many, many parts of the world. Just to remind ourselves of what the WHO Euro recommend for environmentally sustainable health systems. They have 10 proposed actions, and I think a lot of them are the generic things that would be across any business, would be having policies and manage waste properly, efficient management of resources, sustainable procurement, getting our health, the emissions of greenhouse gases and air pollution under control. I just highlight 3 areas that I think that have come to the fore that need more work. Disease prevention, health promotion, and public health services. I mean, the WHO are recommending that. I think the lack of that this year has been obvious in relation to COVID-19. And most countries have struggled very badly with COVID-19 and have struggled to provide the types of services people need. And, an awful lot of disinvestment from public health has been occurring. But we also then have positives like creating incentives for change. The COVID-19 was a big incentive for an awful lot of change. And innovative models of care and innovation has occurred to a great extent. I've seen so much of it in the HSE in order to address the needs of COVID-19. So I think that there, some of these things have come to the light. I think particularly in 2020.
Thank
and
you.
I'd say that
just have 1 minute left.
Grand, my last slide now. I'd say something in relation to public health and the pandemics. this particular pandemic. But we have had, it was known the year before last or 2 years ago that we had inadequate pandemic prevention and preparedness globally. I think there's been a disinvestment in public health. I think there's an anti-science thing that's been going on as well. Then land use change and rising human population, all of those will make pandemics more likely. And we're likely to have them again. So if we go back to our old ways, we're likely to have more pandemics and having them with shorter intervals between them. So it's very important that we highlight these synergies that we get from COVID-19 and climate change and public health. I think all the benefits that we have seen, I think we definitely need to identify the adverse effects of that and tackle them. And we need to identify the opportunities for working together more. And I think we're all of us are coming from different perspectives, but we need to pull together, I think, as much as possible. None of us can fix things by ourselves, but we need to work towards coordinated calls for action on all of the areas that we think are important. Thank you very much.
Brilliant. Thank you, Anna. So for our final individual presentation, I'm delighted to welcome my MSF colleague, Dr. Maria Guevara, International Medical Secretary and Planetary Health Advocacy Advisor, to share an insight into the MSF and humanitarian sector efforts in planetary health. So Maria also co-authored a publication that goes alongside the Lancet Countdown Report this year on humanitarian policy, and I'll put a link to that in the chat box of the call. Maria, over to you.
Great, thank you. Can you hear me okay?
Perfect.
So Hannah, I hope I will meet the time frame, but I will do my best. A warm good afternoon to all, hopefully, as it's right now in Geneva raining and snowing. But thank you very much for this opportunity to be part of this rather exciting panel, which I believe has been long overdue. I remember, if I remember correctly, the first conversations we had was in February of this year. At that time, it was for the launch of the 2019 report. But we know what's happened since, and COVID hit us, not but a few weeks after those early exchanges, and everything locked down, as we know. But fortunately, not for good, and hopefully not forever, as here we are finally discussing it. For us at MSF or Médecins Sans Frontières or Doctors Without Borders, we've also certainly come a long way, not only in our relationship with the Lancet Countdown, this is our 3rd year of collaboration, but also with what we understand about climate, environment, and health, which we had once called the elephant in MSF's operational space. Today, I hope I can elaborate further on what that understanding is. Next slide, please, Hella. So what I hope to try to get to is to speak around MSF's take on the tale of 2 or so maps on vulnerability versus responsibility, the 2 sides of the coin of adaptation and mitigation, share a bit of our experiences and the key messages that's outlined in the policy brief that we wrote that Hannah had mentioned, why we have been using the planetary health lens, especially from the MSF Switzerland branch, and then the lessons from the COVID itself and the need to perhaps reset. Next. So just a reality check and a quick reminder, as Professor Morrissey had already clearly stated earlier, the Lancet Countdown 2020 report reminds us that no continent, country, or community is immune from the health impacts of climate change. The reality is that climate is changing. People, we, are causing the climate to change, and that societal consequences of climate change are highly uncertain, and they do include potential for serious impacts, and we know this is true for health, but that there are options for climate change risk management. Next. So first, of course, I would share the first map to be the MSF map. For those who don't know us, Médecins Sans Frontières or Doctors Without Borders is an independent international medical humanitarian organization who was founded in 1971 at the wake of the Biafra War in Nigeria, where the group of doctors and journalists have come together, having directly witnessed the ravages of the war and the famine on the populations caught in the middle. And because they were unable to stay silent, felt the world needed to know just what was happening. And at its birth, MSF at the organization was 300 staff strong. Today, we are a worldwide movement of more than 45,000 staff globally, at least according to our 2019 report. And in that year, we ran 437 projects in 74 countries, as you can see where all the red is highlighted. 58% of those are in either on conflict, internally unstable or post-conflict settings, a majority being 59% in Africa, with only a smattering of 4% in Europe and a bit more in the Americas. So in figures, what does that mean? It means at least 10 million outpatient consultations in a year, over 840,000 admissions to our various hospitals, hospital structures that we work alongside the ministries of health, translating into more than 2.6 million cases of malaria, 47,000 cases of cholera, over 78,000 malnourished cases treated, 400,000 individuals' mental health consultations. And those are just a few figures. But 2020, however, is a little different, which we will touch on briefly later on. Next slide. The second map is from the Notre Dame Global Adaptation Initiative. And it is a map of the estimated overall vulnerability and preparedness for climate change. The darker shades show countries with higher vulnerability. But what this map hides is that climate change and the effects of it do not respect borders, really. And what happens, these clean lines don't really show the complexity and interrelatedness of real life. And we know that what happens in Chad or Bangladesh or Central America has actual significance for all of us. And we know this from COVID-19, that our interconnectedness is no longer easy to ignore. So what science tells us about climate change is that any regional benefits will be overshadowed by overwhelmingly negative impacts. And we cannot think of countries and regions in isolation. There's just too many links between global human and environmental systems to ignore them today. Next slide. And so I superimposed the climate hotspots of the Notre Dame Global Adaptation Initiative to ours. And this is where you can see that those match in humanitarian settings. Next slide. But what I really wanted to talk about is this tale of two maps of vulnerability versus responsibility. And as we've read from George Orwell, we know that while all animals are equal, some are more equal than others. And unfortunately, vulnerability and responsibility are unequally distributed with regards to climate change. Most of these environmental changes are caused by high-income countries, yet it is the world's poorest who are feeling most of the effects. And the overwhelming majority of those responsible for climate change is in the north, whereas those most vulnerable is in the south. And as we've seen in the map prior, the predicted global averages of unprecedented temperature projections are not equally distributed, and those regional variations gravely amplify risks for populations who may already lack adaptive capacity to begin with due to existing vulnerabilities and inequities, and many will require humanitarian assistance to survive, with demands that may actually be in excess of the response capabilities of both national and international and other humanitarian actors. Essentially, the poorest with the fewest are most affected and end up being left behind. Sadly, these climate hotspots are blind spots for many in the rest of the world. Next slide, please. Next slide. Yes, so for the two sides of the same coin, and here I have a graph from the American Meteorological Society policy study from October 2014, where they are talking about 4 key actions for climate change risk management. And they've listed 3 proactive ones: adaptation, mitigation, and also geoengineering, and a more broader base of expanding knowledge base. But I really just wanted to focus on the adaptation and mitigation aspects, which I believe, at least from the MSF perspective, are 2 sides of the same coin. And as health practitioners, we basically see it as prevention and treatment, for example, where you might liken mitigation like a disease prevention activity: exercise, eating well, don't drink, don't smoke. And adaptation is like the management of the illness, taking medicines to cope with the symptoms or alleviating problems. So in MSF, we look at both sides, but we also are very, very much aware of our social responsibility. And in the spirit of do no harm principle, we as an institution feel that the social responsibility to take in serious consideration of how we are organizing ourselves and managing our own footprint in terms of our growth and modus operandi is a significant action of operational adaptation. Next slide, please. So that brings me on why we actually do provide information to the policy, to the Lancet Countdown, because it's as mentioned before, we're super grateful for our collaboration, for it not only allows us a platform to bear witness to the plights of the population we serve, but also helps us as an organization take serious note of how climate change, environmental degradation, biodiversity loss, and others have become significant factors in the work that we do. In this brief, we shared what our medical teams in the field around the world and across multiple disciplines experience and see just how climate change has likely exacerbated the health and humanitarian crisis that we respond to, whether that's increased transmission of infectious diseases such as malaria, dengue, or cholera, water security and food security that leads to malnutrition, impacts of heat exposure, including acute dehydration, and as mentioned before, mental health impacts, especially due to extreme weather events and disasters, but also population displacement. Also in this report, we've highlighted our experiences on the dual crisis of COVID and climate, how they outstrip humanitarian capacity together. And we feel that in this global political the global political response to COVID-19 presents a worrying trend, basically serving as a potential harbinger of what may also unfold in the response to climate change, as we're already seeing. That's in particular how political narratives like nationalism, populism, protectionism, often including xenophobic narratives, have undermined public health instead of protecting it. Finally, we also highlight how we are learning to adapt health and humanitarian responses, but also on how to reduce the organization's environmental footprint. So a few quick snapshots from the brief. Next slide. So we've been working in Kyrgyzstan for many years. We have an environmental health project in which we are working to address the health impacts of extractive industry. We're doing this in a collaboration with environmental health experts like Terra Graphics International Foundation. We're trying to develop a practical health risk assessment tool that we can apply in a rapid fashion for field use. We're also working in Bangladesh, where we're witnessing, obviously, climate-related migration, faced with climate change-related shocks, both acute, whether that's flood, or the chronic drought and desertification, have increasingly driven internal displacement and population mobility in Bangladesh, not to mention the refugee flow from the conflict across the border. In this context, internally displaced people are finding themselves in situations of unstable deployment, poor access to social protection, increased risk of preventable illness and injury. And what we're doing there is primary healthcare and occupational healthcare for people in Dhaka's Kamran Girchar slums, where many residents have been forcibly displaced after the flooding and saltwater contamination of their farmlands, as for example. In the next slide, we highlight our work in Pakistan, where we've managed heat waves and heat-related deaths. We've noted that in the recent years of working in Pakistan, that the summers have brought increasingly intense heat, especially in the southern regions. In Karachi, where nearly 15 million people live, high heat and humidity have were exacerbated by power outages, have led to significant numbers of deaths and exposure events, and are expected to even become more frequent. And there we're providing an integrated planning for heat waves into our emergency preparedness strategy in the country. including community sensitization and activities on prevention of health-related illnesses, and hoping to actually leverage this emergency management experience in other heat wave-prone areas. In Haiti also, we've been working on a meteorological, the experience in Haiti has inspired this meteorological and climate anticipation project that is being run now in many countries because of our experience in Haiti during the tropical cyclone Matthew, where it ravaged Haiti in 2016, which resulted in hundreds of deaths and injuries, destruction of infrastructure and devastation of the crops, and contaminated water supplies led to significant cholera cases and vector-borne diseases. And so we thought we should be able to predict this much, much better in the future. And so we're trying to target this most to improve our emergency response. In the next slide, sorry?
Final points, please.
Okay, I will skip. So here are other examples. I just wanted to skip on a couple more slides. Here we have an innovation on cholera in Lake Chilwa. I think it's important that to highlight that operational research in our field projects are very key to this, and this is why we were trying to put this on the table. Next slide, please. Just to highlight that climate smart MSF is a term that we're starting to look into, as in the last few years, we've been really looking at how to measure our carbon footprint and how to measure our waste management so we can better adapt our projects accordingly to ensure that we don't contribute to further harming the environment where we're trying to save lives. Next slide. I just wanted to highlight why we are focusing on planetary health, at least in the MSF Switzerland perspective, is that because we find that in an organization that focuses on humanity, we need to consider our human responsibility in contributing to the Earth's demise, including then to ourselves, and that we don't live in a vacuum, but in a larger whole system. And how we're framing that in the next slide is a real look at 3 pillars of operational adaptation, environmental and footprint mitigation, and providing our voice and adding our amplifying the voice of those who have been affected most by this. Next slide is there are some key messages that we wanted to highlight. And with it, if you do read the policy brief, it's just mainly saying that we cannot do this alone. Our capacities are already at max. And in the next slide, in our experience in COVID, we know that this has shown us that solidarity is the key. Somehow, COVID is kind of showing us the reversal of the maps, of making the South the new North and the North the new South, perhaps. There is some degree of what we call equalization because everybody's affected, but in fact, the disparities remain. The South remain unequally burdened by what's happening, not only with climate change, but also with COVID, and probably is gonna end up not receiving all the new tools that is dispensed to all. I just wanted to end with this picture because this is the poor elephants that have been left out of tourism and fending for themselves in Thailand, but just to highlight that we are not living in a vacuum, and it is our collective responsibility not only to be the cause of, but the solution that we require today, and it's not only a public health priority, but a moral imperative to act. I will leave it there, and I'm sorry to rush through that, but I'm here for questions. Thank you very much.
Thank you, Maria. So I'd like to invite the other speakers to put their cameras and mics back on, and also welcome Callum Swift, Dr. Callum Swift, emergency doctor, and also events coordinator for Irish Doctors for the Environment and co-organizer of this event. So we'll go into the panel section now. Any questions that people have, you can put it in the Q&A section or the chat. And Callum, I'll hand it over to you.
Super, thanks so much, Hannah. And thanks for all those fantastic talks. We've got some really great questions coming up, so I'll try and balance them between questions focusing on Ireland and questions focusing on some more international context. And just to address one of the comments from Philip about the kind of dichotomy between mitigation and adaptation, and I think that was nicely talked about by Maria at the end there about how they're two sides of the same coin, and both are necessary. And I also think in the report itself, there's a really lovely analogy between coronavirus and the climate crisis, and how, you know, the initial phase is the rapid gathering of knowledge, the resuscitation, the initiation of treatments, and then it turns to a more longer term thing, looking at minimizing secondary harm, looking at community resilience, and that's kind of reflected in how we should approach the climate crisis. So first question we've got is from, who should we go with? So just to start with Ireland for a little bit, the report makes it clear that the healthcare sector is a huge responsibility. This is a question from Aoife. Not only to adapting in the consequences of climate change, but in helping to mitigate by lowering its greenhouse gas emissions. And NHS England has recently announced a groundbreaking plan to make the organisation net zero by 2040. So she was wondering whether there's any suggestion that the HSE will follow suit. And I think this is a question that Ina might be able to answer. So I'm not sure how you feel about that.
Well, I would like something like that, but I'm not sure that that's the plan at the moment. I think it's something that we're all going to have to ask for, because I think that, you know, the sustainability office is very small. It's a tiny office in the HSE. I don't think it's been, you know, I suppose in a way the leadership of the HSE itself will need to look for a much bigger mandate for this and it needs to be with achievable, you know, the goals of the sustainability within the health sector need to be very clear, agreed, they need to be ambitious and so on. I don't think that's there at the moment. I mean, it's great that we have an office, but in reality, I think, as I mentioned, I don't think the reach is there. I'm not sure how many of us are working in the health sector, in the health service executive in Ireland, but I would see a lot of actions that are not in line with good sustainability practices, and I don't see any plan for changing them, and not a visible plan. So I think, of course, the only thing is there's an opportunity now, because the current strategy is out of date, actually. So I think maybe we need to be calling for the HSE to really do something like what's happening in the NHS in the UK.
Super. And more broadly in Ireland in general, outside the HSE, there's an observation from Pauline that the Irish government's been, generally speaking, asleep at the wheel with regards to climate change, and Climate Case Ireland successfully challenged their plans in the court. And she believes that the latest offering in terms of climate plans has not improved greatly. I don't know if Tim or Ina, you feel that the new formation of government with the Greens in power has significantly changed the outlook for Ireland, or is it all just superficial changes?
I might like to go first, yeah.
I don't think it is superficial. I actually think that there is a genuine commitment at government level. I think that we still need to hold the feet of the politicians to the flame a little bit on this and keep the pressure up from outside. But I actually think that there is a genuine commitment across the three parties in government to tackle this. And I think that the recent climate bill, while imperfect, is a significant step forward. I think that we'll only see the proof of the pudding over the next few years. I am an optimist in this. I actually think that if we can keep the momentum up, Ireland can go from being the second worst country in the EU at climate laggard into being an international leader. And I think the pace of change in this area is so significant that we could go within the space of a couple of years to being, you know, having some level of moral authority on the international stage by demonstrating the action we're taking. So I actually think we have some momentum with the new government, and I actually think that in the next couple of years that's going to be translated into reality. You just need to see the closure of 2 peat-fired power stations this month. They weren't due to close for 7 years, but they're closing now because of the commitment to the new government. You know, they're signs of real progress. They're small steps, but they're heading in the right direction.
Super. And certainly on a personal note, you know, I've been delighted about the cycle lanes popping up all over Dublin, and I'm sure some of that is the coronavirus allowing that to be pushed through, but also some of it must be the Greens in power as well. So that's been a great improvement and plays into the whole active transport co-benefits for health. And while we're on you, Tim, it's a question from Sandra. Addressing climate change will mean a limitation on the privileges that a lot of us have enjoyed to date. How do we frame the conversation to convince those that wish to continue the status quo How do we ensure that the health and well-being of the many is prioritised over the loud and opposition few? And for those who don't know, Tim's the CEO of the Irish Heart Foundation, and he's a GP by training, and he's also been a lot of work in the media, including news talk. So you've probably spent a lot of time trying to persuade people to change. And how do you feel about that?
I think this is very difficult. We work in the area, in the Heart Foundation, the area of health promotion, trying to persuade people to change their behaviours. And, we've come to the conclusion that really, if you want to get people to change their behaviours, you need to build in incentives, and those incentives need to be regulatory. So, for instance, if you want people to use more public transport, we need to make it more difficult for them to use their cars. If you want people to fly less, I think we're going to need to remove the subsidy on fuel that airlines currently enjoy, and actually put a carbon tax or some form of tax on aircraft fuel. I think that it's only by government action at that level that we're going to change behaviour significantly. Otherwise, we're reliant on a small number of people who may be more concerned about climate change rather than other, big issues in their lives. And you can't blame people for being more concerned about other issues. But I think if we want to actually get widespread societal change, it needs to be led by action at government level, and it needs to be across our taxation system and, the whole regulatory environment.
Sorry, Karyn wants to come in there.
Yeah, I find this narrative around the idea of giving up our privileges quite bizarre, because in many ways, I don't think people quite understand how climate change will ravage our privileges and our actual, and there's a lot of talk about our civil rights, etc. And that to actually maintain our privilege and to maintain our civil rights and humanitarian rights across all countries, we have to do something about climate change. It's not, at this stage, I really think the narrative needs to change. And I have some hope that COVID will show people this, but let's see.
Yeah, certainly. And working in health, it's kind of obvious for decades that the government have been involved in curtailing people's freedoms to some extent in order to benefit society. And we have to drive under the speed limits, and we have to wear seatbelts, and we can't smoke indoors. And those are all sensible things that are curtailments on individual freedom for the greater good and for individual good. And I think that needs to be made more often. And Ireland was a global leader. I think we were the first country in the world to ban smoking indoors. So it shows that we're not always the laggards, and when we want to show leadership, we can. I've got a question here from Bianca, and I think this is best addressed to Maria. How do we, can you discuss some examples of how MSF is adapting or mitigating the climate health risks in their operation? And then a similar question from Niall, how exactly have you worked on making houses and communities more resilient to heat waves in your Pakistan program?
Yeah, so both are kind of related, so I'll try to answer them in sequence as they are asked. Basically, just to say that there's been some resistance in MSF really to start to look at this in a formal manner, because we feel that in any case, we're always responding to crisis and we're always adapting. So one of the real purpose of operational adaptation is the mainstreaming aspect, to include in our analysis and the way we assess extreme or emergencies in general, really puts into question also a look at the climate, the changes that's being begotten from it, environmental degradation, and how that really is impacting and or driving perhaps some of the crises that we're responding to. And by better knowledge and analysis of that, we then design an emergency response that is more adapted, more efficient, and more effective. And hopefully we won't also become the victims in better planning. I mean, in some of the projects and operations that I've run and also been part of, for example, Typhoon Haiyan, I mean, we know that even the best prepared people who were actually the community themselves they were obviously still first the victims too. So it's sort of this collaboration with the communities and all other actors that we try to engage within in our analysis and make sure that we are complementing each other. We're not always the best partners, but this is also part of the plan of adaptation, is building these alliances and knowledge base with the experts. We are doctors for sure, and some may call us scientists, but we're not the ones that are necessarily taking each day to really look at this and study the links, which is why we are very grateful for the relationship with Lancet, who can then link us to the experts of this. We are the implementers and the actors on health and humanitarian response. And to answer the heat wave question, because we don't focus so much on the shelter aspects of this, it's not so much making the houses more resilient, it's making the people more resilient. So we're making the communities understand how they can respond better to their health when they are impacted, providing the services for them so they can have access to the healthcare they need for any heat-related illness, and also providing the much needed water points or the basic needs to help them with mitigating a heat-related illness. And this is sort of how we're focusing on it and adapting our operations, but also a big component of it is is anticipating, and this is why I was highlighting quickly the meteorological climate adaptation tool that we're trying to implement, and many others in the process. I hope I've answered that question, both questions.
Thank you very much. And there's another question here, just on the back of that, you know, for MSF, you're treating war-wounded people on the front lines and you're saving lives in the Mediterranean Sea. How do you push the need to adapt to climate change internally when there's so many humanitarian crises to respond to?
Well, again, it's because we're trying to mainstream it. I mean, if you take the Mediterranean Sea and the flow of refugees or migrants in general, I mean, there's a mixed migration process going on today, and it's not just because of conflict that drives people away. It's also because of different environmental impacts on their livelihoods, farmlands, etc., that are driving people away. And this is what we highlighted in the Bangladesh, for example, in the slum areas where they're stuck in these informal settlements, having to fend for themselves. And this is how we tend to address it, is just to understand where they've come from, and if we can mitigate any in that process of whether it's the source of the origin of their migration, the transit, or the destination, we are trying to address it all at that point and adapting our projects according to their needs, and they will be different from one to the other. Super, thank you.
So we have a question from Catherine. Do we need to consider using national welfare indicators, economic, environmental, and social equity indicators of growth rather than economic growth alone, along with inbuilt legislation banning imported goods that originate from agri-deforestation? And perhaps, Karyn, you might answer that as an economist by background.
Yes. So yes, absolutely. We should have been doing this 20 years ago, not just speaking about it now. The need to look at wider indicators of welfare. As I try to get the point across to my students, the difference between economic, socioeconomic, and welfare is crucial. And they don't necessarily, they're not synonymous. They don't all work together, and often they work against each other. So yeah, we absolutely have, just like the Lancet Countdown tracks, sees the benefit of tracking climate change and its impact on health. There's so much to be said for making such a shift, because it shows, my argument is it always shows that there's institutional capacity or interest behind it. So Aina, I just want to go back to your point about whether or not the Irish healthcare system, the HSE, takes up the mantle that the NHS has given in terms of going carbon neutral, and your point that actually there's, it's so small, the initiative is so small in Ireland. I still think that such announcements, regardless of the amount of funding behind it, do indicate and serve as signals, as we say in economics, to indicate institutional backing, and that it can start a momentum. Absolutely. The banning of imported food, well, given that I live in the UK, I can let you know in a year's time as to the impact of imported food when we have loads of trucks backed up in Dover. And I only say that half in jest, actually.
Thank you, Karyn. And another question perhaps for you. Maria touched on mental health effects of climate crisis, and mental health often disproportionately affects younger people. So it's a question from Suzanne in relation to adolescent health and engagement in general. What's the commitments within this Lancet Commission, specifically on adolescents' health?
I saw that pop up actually, and whilst we are increasingly putting a focus on mental health, we haven't looked at different age groups as it stands, but one of our main goals of next year and over the coming years is to look at the impact of climate change across different vulnerable groups. So adolescents will be a key indicator for us. I just want to point out, I heard a survey result during the week that something like 50% of adolescents globally have climate environmental anxiety. So our noise about climate change is not falling on deaf ears. It's just unfortunately falling on the ears of the people that have the least amount of agency or autonomy to do something about it at the moment.
Thank you. So it's a question from James that I think Tim might answer. The 2020 report represents a new indicator of excess red meat consumption, stating that the high red meat consumption was responsible for 990,000 deaths globally in 2017. So do you have any tips on communicating the need to reduce red meat to the fry-loving Irish public? And what do you make of the recent acceleration in non-meat-based alternatives in Ireland?
Well, as someone who hasn't eaten meat for 30 years, I'm hugely encouraged by the rise in meat substitutes. And I think that's probably going to be the single biggest factor in reducing red meat consumption. I think that the quality and the pricing of meat substitutes are actually going to be a key factor, and I think that they will eventually drive a reduction in red meat consumption. We obviously have to get the message out as well to people that excess consumption of red meat is damaging their health, but that's much more difficult, and we are running counter to government policy in this area, where we have a very, very strong agriculture sector who hold significant political sway, and so the government is unlikely to lead on a message to tell people to cut down on their meat consumption. But I think that certain organizations like the Heart Foundation, we will certainly be leading out with messages like that. But I think ultimately it's going to be a younger generation that are less concerned about health and more concerned about animal welfare, that I think will drive the consumption of meat substitutes and the ultimate reduction in the amount of red meat that's eaten. I think my generation are probably the worst for eating red meat, but what I see among my own kids, I've got 3 sons. One of them is a vegan, and 2 of them are back on meat, but they were vegetarian for a while. But I think that generation are going to drive that change in meat consumption habits.
Super. There's a question for all the panelists, I think, from Sarah, that Tim talked of the tragedy on the horizon, and the report states that a 7.6% reduction in greenhouse gas emissions will be required to keep temperatures well below 2 degrees, representing an increase in current levels of national government ambition by a factor of 5. This seems like an insurmountable task. However, the COVID pandemic has shown us that when the threat is perceived to be great enough, governments can act remarkably quickly. Her question is, how do we communicate the severity of this threat in a fashion that allows governments to act in the same speed they have for coronavirus? And have you seen any causes for optimism on this front?
Could I suggest something? That's okay. I just noticed, I mean, COVID-19 as a pandemic was preventable, but it wasn't. So I suppose in a way, the world has got to work out, how, would we have prevented this if we'd known what it was like? And climate change is something that it's harder to anticipate how it's going to feel. But most of us couldn't imagine what it felt like to be in a pandemic of the size, of the transmissibility with, of COVID-19. And yet, so it was allowed to happen. It is preventable. You can control infectious diseases, and we know we can do it in countries, but it could have been done at the beginning. That's what you're supposed to be doing, is monitoring for emerging infectious diseases and controlling them at source as much as is possible. And so it's really looking at, I think maybe COVID-19 shows us what the failure to prevent can have horrendous consequences for so many people. And and a lot of those consequences, because it's controls, we've had economic effects, mental health effects, and so on. If we didn't control it, it would be we'd be affecting, we have collapse of our health service and loss of, I suppose, trust in civil society and so on. People will protect their health anyway, because they're so willing to do what needs to be done. I think they would have done it anyway. So in a way, I think that maybe using the COVID-19, preventability that wasn't prevented, now we have an opportunity to prevent an awful lot of what climate change is bringing down the line for us. And are we going to do it, or are we just going to let it happen and say it's an awful pity we didn't prevent it? So I'm wondering, can we frame it like that? I think we do know, we can see now what a global catastrophe looks like in certain ways, and this is one that is relatively fixable, we hope, because of a vaccine. Question mark.
I think that there are some straws in the wind, and it's very easy to be pessimistic, and all of the figures are not good, and we are going backwards, with the exception of this year where we managed to stand still. But I think if you look at the pace of change, and one area that's interesting is the area of the markets and investment. Up till 18 months or 2 years ago, green funds were performing poorly. Investors were staying away from them. There was no pressure in large corporates to have ethical and sustainable development policies. That has accelerated unbelievably fast over the last 18 months. So much so that companies are now not getting away with greenwashing anymore. And there are significant investor movements out there that are driving companies around the world to make very significant changes in the way that they invest, in the way that they produce, and in the way that they behave. And that movement started from a standing start, literally, over the last couple of years. So I think that the optimism, my optimism, is around the pace of change rather than where we are today. Where we are today is not in a good place at all, but the pace of change is actually accelerating. And I think that if we can maintain that pace, we may be actually able to hit those targets, not this year or next year, but perhaps closer to 2030.
If I may contribute, so I wanted to address a few things, what's already mentioned, but also the mental health, and to try to answer the One Health question. So just a quick comment on mental health. I mean, I think for MSF, in all the crises that we've been doing in the last, we're nearing our 50-year celebration, mental health has slowly become more integrated in the work that we do. And in the response for COVID especially, I was one of the ones deployed to the US, which is very interesting. Some of the things that we've done during this 2020 year, which I wanted to raise, was that we've actually turned tables around. We've been working a lot actually in Switzerland, in the US, in Italy, in Belgium, in Spain, as well as continuing to work where we usually are in the humanitarian hotspots. And that has generally overstretched us. But my experience when we opened our project in the US was the amount of the mental health anguish, not so much for the patients themselves, but for the caretakers and the healthcare workers. And that was a huge input that we tried to give them advice on how to support those who are having to take care of mass casualties, and to address the care of patients where they can't even reach them, they can't even protect themselves, and they don't have the right PPEs, and how we were managing that and from our experience in MSF. So I think it's a huge component that we've started, that we don't take into consideration enough, and much less what's going to happen as climate change goes further. And I think this is an important realm that we need to pay attention to. On the point on policies in COVID, and where does that go? And you know, in the work that we do, and especially where I sit now in Geneva, and this, you know, discussions on the multilateral platform and call for solidarity, we know that they always somehow fall flat, because what we're hearing is, first, we don't hear enough the community and the civil society organization around the table. There's a lot of plurilateral discussions for the coalition of the willing of people. Even if there's a huge call, there's a lot of this, I'm going to reserve any new tools for my population. And there's a debate today. Is there going to be a humanitarian stock? Is there going to be ones reserved for the most vulnerable that are hidden? There are those populations that are not registered, that are marginalized, displaced in the community because they no longer serve them, because they've come in, because they've migrated because of the conflict that they've tried to flee from. Those people will fall out, and it's a sad sight to hear and see what is a call for solidarity is still a call for one's national sovereignty. So I think there's a role for all the people to actually speak on this and try to bring the community voice on this. And for MSF, we are obviously here to try to help bring and witness to those most vulnerable. And on another note, to try to answer the One Health, because we are framing it from the planetary health perspective, from the MSF Switzerland view, One Health, at least in our practice, and of course it has animal health, human health, and environmental health. In practice, however, it becomes an issue of human and animal health. The environment health usually gets less traction, even though it's very much part of it. And a lot of it has been mainly focused, at least from our exposure, on the antimicrobial resistance kind of narrative, animal husbandry, et cetera. Of course, that feeds into the biodiversity situation, the zoonotic diseases, et cetera, which is what we're having to deal with COVID. For the planetary health framework, we wanted to expand really the broader perspective, because we address all kinds of crises, and really look at not only the climate change as one, not only biodiversity loss as one, not only air pollution, but really look at it as a whole ecosystem, putting the human at the center of that responsibility, and calling out that we need to not only be the drivers of these threats, and therefore causing threats to ourselves, but that we can actually solve this. And this actually pushes the urgency to act today. And this is why we've chosen it this way, but also because it puts the onus on us as the actors of our own health protection by protecting the planet Earth, but also all living beings around it. So hopefully that kind of helps explain it. And I think it's just depending on the focus that you put on, and this is how the different climate change and health, environmental health, eco health, One Health, planetary health, it's just the way we framed it, at least where I sit today in Geneva. I hope that helped. Thank you.
Thank you, Maria. I think that was a fantastic summary, and I think that's a nice note to end on. We've reached the end of the time. We do have one more question from Niall, but I think in the interest of finishing on time, we might give that to the panelists to possibly respond by email, if that's okay. So thank you so much for everyone for being involved, from the panelists Tim Collins, Maria Guevara, Ina Kelly and Karyn Morrissey, and for Hannah Phelan for organising this with ID and for emceeing it. And a huge thank you from Irish Doctors for the Environment for being here, and all the people watching. And you can keep an eye on the Irish Global Health Network, the Irish Doctors for the Environment, and MSF's social media channels and websites to see updates